A Bastrop woman escapes a house fire with her life, but not without cost. Christina Wilcox not only lost her 9-year-old son in that fire, but was also injured while escaping the flames. Adding to her devastation here, her health insurance company denied coverage for the surgery that doctors recommended. So as Christina grieves her son's death, she's also looking for answers. She called the KVUE Defenders for help. Here's investigative reporter Jenny Lee.
If I'm doing anything in the kitchen, I have to make sure that my hand is covered.
Everyday chores
There's not a lot of skin there.
take longer now. Once easy tasks are near impossible.
This is me squeezing the mayonnaise as hard as I can.
Christina Wilcox lost partial use of her right hand after a fire in July of 2025. Those flames destroyed everything. Months later, nothing has changed in the former rental home. Charred appliances, a melted microwave, insulation, and debris everywhere. A 911 call captures the devastation of July 27th.
We need help!
Christina remembers a lot of black smoke.
Woke up to me coughing hysterically.
She says she was sleeping in the living room here with her 9-year-old son, Jude. That's when she noticed the fire. Christina tried to get out through the front door but couldn't. She says that's when she broke this window and fell out. But as soon as Christina landed on the ground, she tried desperately to get back inside the home. A passerby saw the fire and called 911. Christina's terror can be heard in the background.
Is there anyone else in there? I know. Is anyone else in there? She's trying to go back in to get her son.
9-year-old Jude, autistic and nonverbal, was trapped inside the burning home.
And I looked back at her and I started screaming back to her, push me back in. My son's inside, push me back in. And I tried to climb up screaming his name for him to come to me, but there was no noises. And all of a sudden, I have a officer grabbing me and taking me to the front of the house, and I'm just bleeding everywhere. Like just blood is everywhere. It's all over his uniform. It was a horrific scene. So the ambulance came, they put me on the stretcher, and I see him on the stretcher, and they're pumping his chest. I'm just screaming to the nurse, is he alive? Is he alive? And I looked at her and I said, I know you're a mother. I can see it in your face. Is he alive? And she looked at me and said, you didn't make it.
Jude died of smoke inhalation. Christina also lost her dog, Coco. 10 months later,
We're still dealing with it.
Christina is coping.
I'm just wanting to get my life back.
But moving forward
It's never going to be the same, I know that.
isn't easy. Christina knows healing her heart will take time. She didn't know it would take so long to heal her hand.
I mean, the whole nerve's just dead.
In September, Christina says an orthopedic surgeon recommended a nerve graft surgery to repair the nerve damage in her hand. In October, her insurance company, Cigna Healthcare, denied the procedure. The reason? Not medically necessary, and that the surgery was considered experimental. Christina says that's unacceptable.
In that case, every surgery is experimental because there's never no doctor will ever tell you 100% that something's going to work.
Christina says she didn't understand and couldn't get answers, so she called the KVUE Defenders. We reached out to Cigna Healthcare for answers. The Cigna spokesperson cited privacy laws. In a statement, the spokesperson wrote in part, quote, our coverage guidelines are developed using the latest medical research and clinical evidence from leading medical organizations and are regularly reviewed and updated by physician specialists, end quote.
You almost need a PhD in health insurance to be able to understand what's going on.
Michelle Long is a senior policy manager for KFF, a nonprofit, nonpartisan health insurance policy research organization.
We already know healthcare costs are one of consumers' biggest concerns right now.
In March, KFF released its latest findings on claims denials. Insurance companies reported receiving nearly 496 million claims in 2024. Out of the little more than 451 million in-network claims, 85 million, or 19%, were denied. Out-of-network claims totaled a little more than 44 million, with a denial rate of 37%. The analysis only covers plans in the Affordable Care Act marketplace, so private insurers, like the one Christina has, are not required to disclose that information.
And we found that 1 in 3 insured adults say that they found prior authorizations to be a major burden to getting health care.
KFF found that Texas has the highest single insured level denial rate in the entire country. Long says if your claim gets denied,
document everything.
And depending on your plan, you can either reach out to the Texas Department of Insurance or the U.S. Department of Labor to file complaints.
A lot of people don't know what their rights are.
As a claims adjuster herself, Christina did know her rights, but she only heard back from Cigna after the KVUE Defenders got involved.
I can't salute properly. I'm a veteran.
The Navy veteran said Cigna has now found another doctor to repair her hand, but no appointment just yet. She hopes this can become a distant memory soon, as she tries to move on, keeping another memory alive.
I miss his kisses so much. I miss his snuggles.
Jude's urn sits in the center of Christina's new rental home. Her son's ashes are also in a necklace she never takes off.
You know, I miss him just patting me on the head.
For the KVUE Defenders, I'm Jenny Lee.
And last week, Christina told us her policy with Cigna expired in April, not the end of May as she was originally told. Now she must wait out the enrollment period with her new insurance company before she tries to go through the approval process again. We have more information on health insurance denial rates and what you can do if your claim gets denied right now with this story at our website, KVUE.com.